Welcome back to the Wellness Rundown, everyone. My name is Mari Ferrel, and for our special guest today, we have Dr. Brian Weis. Thank you for being here, Dr. Weis. He is the Regional Dean, and it's a long title, at the Texas Tech Health Sciences Center School of Medicine.
Yes, thank you.
And thank you so much for being here today.
Thanks for the opportunity.
Of course. Today, in the Wellness Rundown, we don't just talk about like nutrition, fitness. We also want to highlight the topic of mental health. That is really important. And sometimes I feel like people don't talk about it. Sorry about that. I'm going to go ahead and restart.
That's right.
I knew it was okay. Redo. 3, 2, 1. Hello, everyone, and welcome back to the Wellness Rundown podcast. My name is Mari Ferrel, and for our special guest today, we have Dr. Brian Weis, the Regional Dean of the Texas Tech Health Sciences Center School of Medicine.
Yeah.
Dr. Weis, thank you.
Thank you for this opportunity.
Yes, of course. And here in the Wellness Rundown, we talk about nutrition. We've talked about food, fitness, but I also wanted to bring in Dr. Weis to talk about a really important topic that I feel like it's not really talked about enough, which is mental health. Mental health issues, and that's what we're going to be highlighting today, especially since it is Suicide Prevention Month in the month of September. And Dr. Brian Weis, can you talk about this mental health crisis that is among healthcare providers?
Yeah. So September 17th is Physician Suicide Awareness Day. Again, but it really is a much broader topic. It's suicide awareness among healthcare professionals.
Yes.
And this has become a major problem in our country. I mean, right now, we lose about 300 to 400 physicians a year due to suicide in the United States.
Wow.
And what I'm talking about is I know personally 5 physicians in the KAMR Local community that took their own lives in the last 15 years. So this is a major
Yes.
challenge. And then we look at nursing. I look at first responders, major problem among first responders. So it is across the whole healthcare spectrum that we see this issue.
That I did not realize that. So it's not just like a local issue, but it's also national. So many people die by suicide each year. That is a really eye-opening stat right there. And can you kind of tell us more about the issue? Like, why is this an issue among the healthcare community?
Yeah. Well, Mari, there's multiple factors here. I think the two main that come to mind is first of all, it's just the nature of the business we're in. Okay, you look at particularly first responders. They oftentimes are the ones who respond to emergencies. They see tragedy. They see trauma. Okay? And then you get to nurses and doctors, and a lot of times we're dealing with those same issues of just obviously seeing people suffer, and so you can't help but be affected by that, particularly day in and day out as you're seeing this. So that's one thing. Is in fact just the nature of the beast is people can quickly get emotionally caught up in their work and become depressed or anxious about this. I mean, the second thing is there's that stigma of, okay, I'm a healthcare professional. Pretty much all of us have a license in some way. Okay? So a physician license, nursing license, stuff like that. And there's this question of, well, could my license be at risk if I somehow admit that I'm vulnerable or maybe impaired to a certain extent from mental illness?
Okay.
So that's the other fear is the fear of, gosh, I hope no one knows I'm seeking help or something like that. It's kind of interesting. One thing is a lot of times when we apply for our licenses, and that for doctors it's every couple of years, there used to be these questions on license asking, basically asking, have you sought help for mental health issues? And there's this fear of, what if I put yes? Okay, so the good news is that there's several organizations nationally that are trying to get those questions removed from this licensing because, again, it's almost like I'm afraid to put an answer here and tell the truth.
I did not know that was a question whenever you try to get your license. Yeah, I can see that. The healthcare community, they see quite a bit. I mean, they see the good, bad, and the ugly, unfortunately, and they try to internalize it, which is
absolutely. And there's always been a thing of the stoicism. Oh, I can take this. I'm tough. I'll shake it off. Well, that's not how our bodies work. That's not how our brains work. And and we know that a lot of times when people see traumatic things, there's an emotional impact that if at that moment you're not appreciating it, it may come back and haunt you weeks or months down the road, and you don't even realize that is what actually is triggering maybe this depression or anxiety you're feeling.
Yeah, you're bottling up all the things you see, the feelings, all your emotions. So, my goodness, yeah, that's crazy. So kind of going talking about the contributing factors. So job stress, burnout, how does that, affect?
Yeah, so all those above. We talk about things like burnout. And burnout, technically, the definition of burnout is where you feel that you are powerless to change your situation, and that's really what burnout is. It is, so what we see is a lot of times, in particular, I talk about physicians. We get these situations where you're seeing patients. We have to deal with electronic medical records, which have been a major burden. I mean, they've been great, but at the same time, is suddenly physicians are sitting in front of a computer hours after their clinic or hours after the hospital, doing all the computer work and things like that. Things that used to be done by your support staff. Now the doctor does it all. He sends them prescription, do referrals. So the EMR has been a major problem in terms of just doctors feeling, I can't get away from this computer. And so the same thing, I think, is if you look among first responders, same thing is day in, day out, they're seeing these traumatic events, right? And they eventually they become feel powerless to change that or somehow modify what they're doing. And that's the biggest thing with burnout. It's just long hours, and a lot of times work that just wears you down.
Yes, it is tough, and I have so much respect for anyone that's working, the first responders, and like anyone in the healthcare community. And also, can you talk about another contributing factor as well, like perfectionism? I mean, that can be found, honestly, in any industry, in any community, work community. Like the feeling of wanting to be perfect and just striving for that, and they kind of lose themselves sometimes. Can you talk about that?
Absolutely, right. One thing we see is that a lot of the physician suicides we see are usually during a time when that physician is being sued for malpractice. Okay? So, and again, you talk about this perfectionism. I mean, unfortunately, that is essentially the expectation for doctors. Right? And when you do make a mistake, which we all do, we're all human. Okay? The question is, am I going to be sued? Have I caused harm to someone? But particularly you look at litigation against physicians. Several of the physicians I know that have taken their own lives were at times that they were being sued for malpractice or threatened in that way. So that's a big part of it too. Is just the idea of, my goodness, my job every day is I have to be on top of my game at all times, or these things can happen.
Oh, I didn't even think about that. The getting sued for malpractice, that is a lot of pressure. I mean, being a doctor, being any, that's a big, issue.
I knew a physician in Dallas that took his own life, and it was during a malpractice suit. And he was in the courtroom. They had professional testimony against him, basically, and he left a suicide note that says, I can no longer live in a world where they're bringing in these professionals that are essentially just making stuff up against me.
Oh my goodness.
And so again, that's a big stressor too.
Wow, I didn't even realize that. So I'm learning so much just talking to you, Dr. Weis. How can the healthcare professionals decrease like the thought of suicide? What can happen to like decrease the suicide rates?
Yeah, so I think we're learning a lot of things. And a lot of times the stress starts at the time of training. Okay? So back when I was a med student and a resident, we didn't talk about these things. And so certainly many years ago when I was a resident, there was no limits on the hours we had to work. There was no limits on the number of patients we had to take care of. Right? You just kept going until things were done. And so it wasn't uncommon for me to be 36 hours on call. Not sleep for 2 days.
Oh my goodness!
And these were the requirements at the time. I tell people, my surgery resident colleagues were on call every third day for 5 years. Unbelievable! I don't know how those folks did it. They would show up at the hospital on Monday and maybe not leave till Friday. And so these are the things that we realize that stress starts even during training, and so we're being much more aware of that.
Yes.
And so there's now a lot of regulations and guidelines that are limiting the number of hours residents work, the number of patients they can admit to the hospital on a given day. Again, trying to find some balance where they can get away and recharge their batteries, if you will. And so what we're finding is, like at T2HSC, is we talk a lot about wellness now, okay? Student wellness, resident wellness, faculty wellness. We have committees that's their whole job is, what are we going to do next to make sure that we have some activity that we're trying to help people find that balance between work and life. So the good news is the conversation is much more on the forefront right now. And there's a lot of national organizations, including a lot of physician, nursing organizations, first responder organizations that are making this a big part of their campaign and a priority.
That's good. That was one of the questions I was going to ask. Like, what's the difference that you've seen from back then to now? But yeah, I think like back in the day, mental health was something that was kind of taboo a little bit. You kind of just pushed to the side, like just toughen up and you'll be fine. Like that. But nowadays, I'm so glad that more people are speaking up, talking about it, because it really is important. And the healthcare community does so much for us. And it's like the least thing we can do is just, ask if they're doing okay. And I'm glad that y'all are doing that. And kind of still speaking on this topic, y'all had an event out at Texas Tech Health Sciences Center to talk about the September 17th day.
Yeah, thank you. This is our third year now to acknowledge this day of physician suicide awareness. And so what we do is all 3 years we brought in national speakers who basically have expertise on physician wellness, but overall healthcare personnel wellness. So we bring in these speakers. We have our grand rounds from noon to 1 o'clock. And then what we've done in the past and this year too is we lay a wreath in the front of T2HSC, to remember those we've lost, to suicide. So it's been a wonderful event. We invite all the healthcare people in the community. We also broadcast it to Lubbock and to Odessa, to our other T2HSC campuses.
Oh, okay.
We're literally essentially requiring the students to watch. Okay? Again, the more that we can make them aware of this earlier in their training, hopefully they'll continue to make this a priority throughout their training. So it's a great event. We also bring in a lot of local community resources for mental health. So they come, they set up tables, and that way people can see that there are resources in this community, and great resources to help people in need for mental health wellness.
That's good. And why is it so important to have these events in the community and just like raising awareness?
That's the biggest thing. It's just people have to have it in the forefront of their mind that that there are there may be people around them that may be hurting, and the more that we all think about it and think about, okay, what are the signs of someone who may be in distress, and how can we point them in the right direction to those resources, they can get the help they need before it's too late.
That's great. And it's something that we need to talk about all year round, not just in the month of September.
Absolutely.
Which, I mean, and it's great to highlight it in September, and hopefully we can continue to talk about it throughout the year. That's great. And Dr. Weis, do you have any advice for healthcare professionals, even if they're not in the healthcare community as well, just any individuals just feeling heavy, dealing with mental health issues?
Absolutely. I think the biggest thing is you hear the common phrase, if you see something, say something. Right? I'm going to change it a little and say, if you sense something, say something. What I mean by that is when you look at the people around you, okay, what we're looking for is suddenly someone's just not themselves. Okay, they're withdrawing. Maybe they're just not having fun, the things that they've done for fun in the past. Maybe they're not speaking out, or they're say something. Sometimes just acknowledging that person may be suffering something can open up that conversation with them. And so the whole idea is if you see someone around you, they're going, I wonder, say it. Speak to them. Because it's one thing I found too is in those individuals who unfortunately have taken their lives, what you're left with is a lot of people around them that go, boy, I kind of wish I had said something. I knew something wasn't quite right. Or looking back, they're going, gosh, if only I had done this. And that's a terrible feeling for any of us that are left behind going, could I have made a difference?
What if?
Maybe, the what if. Right. And so the whole idea, if you sense something, say something. If you sense someone is struggling or having problems, confront them. And encourage them to seek the help they need.
That's a great piece of advice, Dr. Weis. And that's good to and for one more time before we end, you said if you sense something, not just see, but if you sense something is off.
And maybe you can't put your fingers on it, but you're going, they're just not who they usually are. Something's going on. Yeah. And again, it could be, one of those things you just say, hey, I've noticed you're not who you normally are. Is something wrong? or can I help you in some way, or and sometimes just opening up that conversation. You'd be surprised how people suddenly take that as that welcome.
Like, oh, someone cares.
Yeah, someone cares.
Someone wants to listen.
Someone's noticed.
That's great. Yeah. Well, thank you so much for speaking on this topic. I'm glad, because on the wellness rundown, again, I don't want to just highlight like the nutrition, the fitness. Yeah, that's important. That is wellness, but a big topic that needs to be talked about more is definitely mental health. And thank you for being here today.
Absolutely. I appreciate the opportunity. Thank you.
Yeah, and shining light on this topic. So thank you. And that is it for the Wellness Rundown. We'll see you back here soon.